We're talking about keratoconjunctivitis. So basically, guys, what is keratoconjunctivitis? Basic keratoconjunctivitis is going to be, sorry about that, is basically it's going to be like a non-infectious keratopathy in which we're going to get inflammation of our conjunctiva. So just a few words about our conjunctiva. What is our conjunctiva? Our conjunctiva consists of the bulbar part, a fornix, which is kind of like the middle part, which is kind of connecting these two, and it's also going to be the palpebral or the tarsal part. So that's going to be the kind of the front part. So if you can see the eye, so the front part would be kind of like the tarsal, the palpebral part, and the back part would be kind of like the bulbar part. Okay, so it's going to be basically what happens is when we conjunctivitis, we can get a non-infectious keratopathy, which can lead to decreased amount of moistening of the conjunctiva, and it can lead to a dry eye. Dry eye can cause a lot of problems because it can lead to infections. As we know, our tear film is kind of made out of three main layers, which is the lipid, the aqueous, and the mucinous layer. And kind of like, if we just have a look at these notes, which these are not mine, so don't know who to copyright in these ones, but there was one excellent photo which I want to share with you all. Yeah, so as we can see over here, it basically it basically what happens is the oily over here, what we have over here is that we're going to have some enzymes. So we're going to have some enzymes present in the watery layer. This is going to really help us to kind of digest the bacteria, and obviously epithelium is always protective, and we also have this lipid layer which kind of prevents the removal of moisture. It kind of prevents desiccation, kind of prevents removal of moisture. So this is one of the main thing, and it can obviously lead to infections, and not only infections, but it can also lead to corneal abrasions, corneal ulcers, and eventually decreased quality of life, or even vision loss can maybe occur. What is the epidemiology? Well, it's autoimmune disease, so you can already tell what autoimmune disease would mean. It means to be more in women or males. So for example, Graves' Bezos disease is another one. That is going to be more in the males. More in the females, because it's autoimmune. So it's going around the 40 to 50 years for middle adults, and this is maybe some sort of hormonal changes in the menopause. I don't know the exact reason. I have some notes over here. So I don't know the exact reason behind this. Why? What is the kind of the reason behind the fact that there may be some sort of hormonal changes? But when I checked it on Google, they didn't really explain well. So not 100% sure over here. So what is the etiology of the keratoconjunctivitis or the sicca? What's the causes? Like I said, it was a non-infectious keratopathy, right? So it can be rheumatoid arthritis, Sjögren's syndrome. Do remember, like rheumatoid arthritis can cause also uveitis, so don't confuse that. And Sjögren's syndrome causes dry eye and dry mouth. So it not only affects our lacrimal glands, but it also does affect our salivary glands. So some mandibular, sublingual, parotid, whatever ones there. What alters the composition of the tears? Well, that's going to be the varnas. So the varnas, what does the varnas mean? So the varnas basically means that there's going to be vitamin A deficiency. Varnas, by the way, means like a castle. I think this is more common in the South Asian countries, a varnas. And a varnas it's kind of like there to kind of help with protection. So we might as well kind of mention it over here. The varnas is kind of like it's kind of a mnemonic. So the V over here it's going to cause being vitamin deficiencies. So that can also be there. And that'd be obviously vitamin A deficiencies, the VA. The R over here will kind of be referring to retinoids. So if you use retinoids, you may have a kind of a chance of altering your tears. The next over here is going to be the N. What does N stand for? N stands for maybe nicotine. Nicotine could possibly kind of lead to changes in our tears, and also the smog, the fog, everything in a city. In the city lifestyle, we're going to be seeing all of this smog, air conditioning, and then A. How about A? A is going to be anticholinergic. So drugs can possibly cause dry eye. So anticholinergics, what example comes to mind? Well, one example that any type of anticholinergic which inhibits acetylcholine by binding to the muscarinic receptors on the salivary gland. Diuretics again, so that's going to be the A, and the S over here will possibly be the smog. Other things can be maybe probably aging, corneal drying. Diuretics can possibly cause dry eye. Just want to double check which drugs cause dry eyes. I just want to get some names out here. I think it's scopolamine, but I don't want to be giving false information. Let's just type. I think it might be atropine, but let me just see. Anticholinergic drugs. Yeah, so atropine is on the top of the list. Belladonna alkaloids. Belladonna alkaloids. We can also, I believe, there's one other one called heptropine. Hemotropine? No. Yeah, hematropine, homatropine. So homatropine are also anti-atropine. Homatropine can also be there. We can get belladonic alkaloids is also going to be there. So cyclopentolate, and I believe so anti-Parkinson drugs such as the trihexyphenidaline and the tolterodine. No, that's something else. Trihexyphenidaline and hexaphenediol and benztropine, trihexyphenidiol and benztropine. Okay, perfect. So let's get back into the PowerPoint. Yeah, perfect. Okay, so as we were saying, drugs can also kind of maybe affect the eye as well. Um, so yeah. Yeah, so let's go over here. What other things we're gonna be talking about over here? So we're gonna talk about burning. We're gonna get burning. Here, large, big red fortress. I just spoke with the Vernas. The Vernas is also gonna be there, which may cause this. So maybe large will be lacrimation. The B would be burning. R would be redness, and the fortress would be foreign body sensation. So lacrimation is going to be a reflex from maybe the wind or the cold, and maybe reflex with maybe bleeding, and like complications, like I said, abrasions, ulcers of the cornea. How do you diagnose keratoconjunctivitis? Well, there's 5 tests. Yeah, 5 tests. You wouldn't believe it. So yeah, the first test is kind of like a more of a called a quantity test, which shows that you basically are going to get the eyes, and on the lower part of the conjunctiva you put a paper, and you keep this for approximately 5 minutes, and it can then you kind of look for amount of water that is going to be in the eyelids. So it should be approximately 15 millimeters, if I'm not mistaken. Should double check that. So yeah, it should be at least 15 millimeters. Less than 5 millimeters would suggest rheumatoid arthritis. Breakup time is more of a quality test. So you have to make sure you give them a fluorescent dye. You make sure that you put it there, and any sort of from the first blink to any sort of break in that dye would identify that this person has skirmic. The breakup test, which is like approximately 15 seconds. So that's the thing. Next thing, look at light examination. Look for dilated conjunctival vessels. In less severe cases, the eye would only be reddened, but application of the fluorescent dye would reveal some sort of corneal lesions. How about the Rose Bengal test? The Rose Bengal test, it reveals conjunctival and corneal symptoms of desiccation. So the Rose Bengal test is more of looking for it stains for dead epithelial cells and mucin, and this is the Rose Bengal test. It will really stain for that, and the Lisamen green dye is going to be there for lacrimal disease, lacrimal such as acute cryoadenitis and acute cystitis, and then obviously congenital atrasias and whatnot. There can be some sort of probation, irrigation. Yeah, so Lassaman green is going to be affinity for the dead epithelial cells. Okay, so that's going to be it. How would you treat this? So treatment would be plugs. So plugs will kind of lead to accumulation of fluid, and that will kind of help to kind of lubricate the eyes. Artificial tears will help against preventing dry eyes. Which type of artificial tears would I give? Ointments as well. So what are the names of these? Artificial check would be yeah. So we can use this called artificial. Yeah, they don't have any specific names. So yeah. The next one is cyclosporin. I do not know how it helps with lacrimation, but I think how cyclosporin works is it kind of increases tear production So it decreases swelling in the eye, allowing for air, for more amount of, so it's more like pack or cap. So guys, I hope you found this useful. Hope it's useful. I try to include as many mnemonics as possible to help you guys. Please do like, subscribe, and I hope to see you guys next time.